In our scriptures, there's a mention of a king called Shantanu. When his first wife gave birth to their first son, she actually entered a phase of extreme sadness and had all the symptoms of what we call today depression. She actually stopped taking care of herself and of the child. King Shantanu obviously got very worried and he called a few wise men to actually consult with them. They checked her and they diagnosed her with an illness called Vishad, which has symptoms of extreme despair and sadness. Then they called sage Vyas to actually give her the required treatment. And he actually helped her using our traditional practices of guidance, of yoga, meditation, and Ayurveda. Soon she recovered and she started taking care of herself and of the child. It is very common that women suffer with symptoms of depression right after they enter a very beautiful phase of their life, that is motherhood. They sometimes have symptoms which are very similar to today what we think is depression. So they might have crying spells, they might not even feel attached to the baby, they might be feeling very irritable, they have a very disturbed sleeping pattern, they feel extremely low and sad most of the times. And these are the symptoms of postpartum depression. Not only mothers but even fathers can suffer with this thing. And they might be having symptoms like not being able to feel happy, not feeling attached to the child, a disturbed relationship between the husband and the wife. And it is extremely important that the new parents actually get the help that they need so that they can recover and they can actually enjoy this phase and they can take care of themselves and of the child. The symptoms usually start with right after the birth of the child and they may continue for 1 year since the child has been born. But it is not important that the symptoms can only start right after the child's birth, but they can actually start anywhere in the child's first year of life. So now after we have talked about the symptoms, it is also very important to understand what are the causes for it. So for the new mother, the causes can be genetic, that they might be having a genetic vulnerability or a genetic loading. That is, if the mother has had a history where her mother or her grandmother have had similar symptoms, then there are chances that she is at a higher risk of experiencing postpartum depression. The causes can also be hormonal in nature. So right after the birth of the child takes place, the estrogen and the progesterone levels actually take a dip and they might be the contributing factor to this, and also the reasons might be psychosocial in nature. So apart from the physical changes, the woman also has to take the responsibility of taking care of the child. She has the responsibility of making sure that the baby is okay, he or she is feeding on time. She also has to breastfeed the child. The entire sleep cycle changes, the relationship between the parents changes, because now they stop seeing themselves as a couple or husband and wife, but they rather start identifying themselves as the father or the mother of the new baby. And these changes also contribute when the father suffers with these symptoms. So it is very important that we also know about the causes because of which this can happen, so that we can get them the right help which is needed. Apart from postpartum depression, you might also have the symptoms of postpartum blues. It is very important that we differentiate between the two. So postpartum blues have very similar symptoms to that of depression, but the duration is the main point over here. So if you have the symptoms for less than 2 weeks, then you can simply call it postpartum blues. But if you have symptoms that are extending more than 2 weeks, then usually we suspect that it might be a case of postpartum depression. And if you have any thoughts or any symptoms of self-harm or harming the baby, then it is advised that you immediately go and seek help from a mental health professional. We're going to talk about more as to what you can expect in therapy and what will happen in therapy in the later parts of this playlist. So do watch this entire playlist to know more about it. But right now it is very important to know that we need to be aware of all of the symptoms and causes, so that if you have any of these, you can be aware about it. And also if you are able to see these things in your partner, then also you can be aware about it. We talked about the story of Shantanu and his wife, and it actually an important thing to note over here is that even if you have all of these symptoms or are suffering with all of these concerns, then also it does not make you a bad mother. I know no woman who is a bad mother. The story of Shantanu and his wife has actually helped us raise and understand few very important points. First of all, it tells us that the husband and wife relationship is actually a very big protective factor in all of this. So if you have a supportive spouse, or if you are able to do that support for that, or if you are able to be that support for your husband or your wife, then it can actually make the entire process very easy. And the second thing is that these things have been mentioned in the very ancient Indian scriptures, and hence it is not something which is a result of westernization, or it is not something that we have learned because of social media and stuff like that. It is an illness. Let's take it like that. The treatment is possible, recovering and improvement is definitely possible. We're going to talk about some very good self-help and we're going to talk about some very good self-help and self-care techniques through this entire playlist, so do watch it. Namaste.